4-H Health Rocks program began nationally in the late 90s. Tennessee had one county participating in a local community project. And then in 2008, we took the program statewide. We offered it statewide through a competitive grant process. And since that time, we've had about 40 counties across our state being involved with the program, reaching youth with a minimum of 10 hours of instructional programming out of the curriculum.
The 4-H Health Rocks program is a program that's taught to middle schoolers that teaches them about the effects of alcohol use and drug use and tobacco use, and encourages them not to partake in these things regardless of peer pressure. It teaches them about their emotions and what they'll be going through, and is really, really beneficial for students in middle school. I got the opportunity to go to a Health Rocks training weekend and then met with my extension agent, and she set me up to be a teen teacher in a middle school in our county that was the only middle school that did not have a health-related program talking about these substances.
Tennessee is a unique state as far as 4-H is concerned in that we have a school-based program that allows us time in the classroom each month, delivering instructional programming for the youth. So lots of our teachers, lots of our 4-H agents, community partners, teens deliver the 4-H Health Rocks program through the classroom experience during the school day. Other avenues, other outlets have been after-school programming, community-based programming, summer camps, day camps. Really, anytime we have a group of youth that are assembled that fall within the age range, then we have the opportunity to present the program. Health Rocks is unique because it's tied directly to the land grant system. It's an extension program, in this case through the University of Tennessee Extension, and so we have the opportunity to make sure that we know that it's research-based. Everything that we put out through 4-H and Extension is research-based. We know it works. We have instruments that have helped us collect data for years, and that data shows that our youth are having knowledge gain, and they're making attitudinal changes as a result of this program. The 4-H Health Rocks program is an outstanding program. It's one of the largest programs that we do in Tennessee 4-H, and the great thing is that we have the capacity to take it even farther. As many counties as we have in the program, there's still an opportunity for counties to partner with local community groups, with classrooms, agencies that are willing to work with us and interested in working with us and getting the message out there. So the real opportunity is for folks that are interested in being a part of our program to contact their county extension office.
Whenever I taught, I got that the best learning method for them was whenever we would take one of the things that we were talking about, like alcohol use, and we would make skits about it and of situations of what they need to say and what they don't need to say, to see the bad and good outcomes of what they could do in these situations if they get put in them. And whenever they got to work on the skits, then they got to talk with each other. They got conversations with their peers, all talking about how influences that come onto them can be combated. And I think that was the most beneficial way of them learning.
Weeds, things worse, things awesome cars.
1, 2, ready, go.
Smoke, 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 it's gross, it makes my throat feel rough. Coughing and panting, choking and wheezing, there's poison in every puff.
1, 2, 3.
The curriculum was incredible. It was very, very simple to teach. Me and my extension agent went over all the lessons I was planning on learning or teaching, and I would get all the stuff together before I went into the classroom. Normally, it was not very much lecture and a lot of hands-on, which really helped the students stay engaged, because whenever you're at that young of an age and you have such a short attention span, it's hard to just listen to someone come in and talk every day. So having all the different activities to go with each concept that Health Rocks was trying to get across was really beneficial. For me, the way it impacted my life is because I really got to see the need for programs like this. I've been in Acting for Life, and I've been in programs that have taught me about the substance abuse and things that go on and how to combat peer pressure before I ever taught this. But I didn't realize the need that like some students have never gotten that, and some students like really don't understand what, or like don't feel like they can combat peer pressure. And so seeing this like when interacting with them was really like moving to me, and like showed how important programs like Health Rocks are. I think what I enjoyed most was whenever like the kids really got into an activity. Like one of them, they wrote everything that was important to them on a balloon, and we were like tossing them around the room to show like how easy it was whenever like you put too many things on your plate, such as like alcohol addictions and all this other stuff, to like drop some of the things that are important to you. And just seeing them like put so much thought into it, and like how hard they were trying to make sure that they did it correctly to like get the point of the activities was my favorite part of the Health Rocks program.